all for being here today. I'm Vinesha Ramasamy. I'm another cancer survivor like John. So I just wanted to start off with asking you guys to imagine your life at 15 years old. What were you doing? What was the highlight of your, that year of your life? If you just reflect back on that. So I'll tell you what my life was kind of like from 15 onwards, and how a lot of those highlights that you might have imagined at 15 to who you are now, all those things, how when it's like layered with cancer survivorship, with side effects, with chronic pain, how much different it is to even be a survivor and have quality of life. So I'll just start off with sharing my story. So I was just a pretty nerdy kid growing up. Just really enjoyed school and watching the Raptors and seeing them win. Now it's great. But just had a great family, an older brother. My parents were refugees from Sri Lanka from the war that was happening, and so we were really just lucky and thankful to be here, blessed to be here. Wouldn't have imagined how much more grateful we'd be for being here until like years later. So when I was 15, I was starting grade 10, and I just started having a lot of leg pain, and just being a teenager, going to the doctor, you're just told, growing pains, teenage woes, all that kind of stuff. And so just, used Tylenol, used ice packs, just rested it off. And it was when I was starting to miss school is when my teachers started to be like, no, this is not normal if she's missing school. And so they told my parents, go back to the doctor, and just make sure you get an x-ray. Don't leave without it. And we're not very familiar, just being my parents coming here as immigrants and refugees, just kind of being like blue-collar workers in the minimum wage field. We don't have a lot of history of having like family with medical knowledge. My generation's the first one going to university, so we didn't know anything besides hearing, this teacher we trusted said go and get an x-ray and don't leave without it. And so thankfully we did that a couple of months after this pain started, and then they called us back and said, there's this big shadow. Going to do some more tests and then send you to Sick Kids with all your scans. And so we went to Sick Kids, and I still remember taking my school books because I didn't know what was happening. I just knew, I'm going for some doctor's appointments, but my life was like a student, a sister, a daughter, a friend, a cousin. And so we went in, and when we see, a doctor, like a very respected doctor looking worried, is when we can just sense that it's going to be a hard journey. And so they told us kind of what it was going to be like, and so what they suspected it was, did a biopsy, and between the biopsy and the results, all I would do was Google. And so if you know bone cancer, the person that comes up is Terry Fox. And you know what his journey was like. And so that's really all I had to go on, and it was just like, I didn't tell my parents that I knew this, but I was inquisitive, and I said, okay, well, maybe that's all I'll expect, right? And so went to these appointments, went through a biopsy, and they called us back to Sick Kids a few days later, and said, I came with my science textbook studying in the car, and I went into the appointment, and they said, you have cancer, you have like high stage, high grade osteosarcoma, which is bone cancer, so it was throughout my left leg and quite aggressively grown throughout both bones, and they said, you're going to start chemo today. And so that was just a really big whirlwind. So I put away my school binders, and we were given this other binder with all the treatment protocols that we're going to expect for the next year, and just saying, okay, like this week, this day 7, this day, and it was like the whole year was like mapped out, and the room just started to be foggy and spinning, and they just said, you're going to start treatment today, and I didn't know what that meant, but very quickly onwards, the first cycle of chemo, we were supposed to be there for 5 days, but had a lot of side effects, was there 9 days, and went home after that for a few days, and everything started going wrong. I had, my blood counts had gone low, had an infection, one of my kidneys had shut down, the other one was shutting down, I had a blood clot in my neck, and so we just went back to Sick Kids, and I didn't know it at the time, but they told my parents, we don't know if she's going to survive these side effects, so let's not just even think about future treatment. And so I spent a month at the hospital, sort of like partly coma, partly sedated. I remember my doctor, he would be there on weekends trying to talk to his doctors and pediatric oncologists across the states at St. Jude's, trying to find some kind of different protocol, something that in case I survive these side effects, what can she do? And so I'm grateful to be here, to have these kinds of resources, such a wealth of knowledge and heart to help survivors survive. And so they, being sick kids and being the cool hospital they are, they let me go on Christmas Eve night and said, go home, just enjoy the next, week at home, try to be careful, all of that kind of stuff. And then they told me to come back, invited me, that sounds so, so nice, but yeah, they asked me to come back in the new year with my parents. And at that time they said, there's a lot of damage, but we're gonna try giving you like a different sort of protocol, like a second and third line therapy that they had sort of put together with other doctors, and they said we'll see what happens with that, really. And having bone cancer, a lot of the treatments have not changed in a long time. It's very aggressive, really, really hard on the body, all inpatient, especially for like younger children. They leave us in the hospital. And so I went through some more months of treatment, and then I went in for a surgery. And so they had said that it would probably be an under the hip amputation, but they'll try their best to save whatever they can do, right? And so went into the surgery, and it was about 9-10 hours, really, really complicated, complex. I came out, I remember waking up in the recovery room, and my mom was at the head of the bed, and I said, do I still have my leg? And she said, yes, you do. And we thought that was amazing. And then discovered that, you'll have your leg, but they've took out all the quads, took out everything in the leg from almost the hip down to the ankle, reconstructed, a lot of muscles were gone. So they said, you'll have your leg, but you probably won't walk. You'll have the big brace, have, maybe just walk around the home, but have a wheelchair, all of that. And so getting that news was a different thing. But in that sort of a space, I just learned I'm still going to be alive. So that's okay, right? Like those are the types of concessions you make as a survivor, where you're like, I'm not going to walk, so what does that mean for my life? But I'm going to be alive. So we're going to figure this out, right? And so after that, despite the difficulty of that, the disability, the injury, like my leg was just all straight all the time, and having nurses and physiotherapists come into my house all the time. We had 6 more months of chemo treatment inpatient in that condition, and you can just imagine, like my parents had to carry me down the stairs and be carried around as like a 15, 16-year-old. It was really difficult, really isolating, and going for 400 blood transfusions, like so many things that happened during that time, but survived it. God's grace, I survived. Went back to school, graduated at the top of my high school class, went to university and was doing really well. And in second year started university. Cancer's like, I was 19, cancer's like kind of in the rear view mirror now. I've been transferred to the adult hospital. They haven't called me back yet, so I'm like, oh, that's a good sign. And then I started having this cough when I was at an economics class with a really scary professor, and he doesn't like noise, and I was just really nervous about that. And my friend was slipping me water and candy, asking, are you okay? But that cough never went away, so that cough just persisted, started missing school, coughing up blood, having like seizures. So we went to my family doctor, because right now it's in between Sick Kids and Mount Sinai, Princess Margaret. I didn't have a doctor yet that I'd visited at the adult hospital. Didn't know where to go. So I went to my family doctor, and he said, something is obviously very wrong. So he did all the scans he could while we were trying to figure out our new oncologist situation. And they found that there was a tumor that was, throughout pretty much all of my left lungs. And we met our new oncologist, and they said it's just a recurrence of your sarcoma tumor, and it's pretty high stage. And this time was different. They had already maxed out all the chemos I could take safely. I was still dealing with a lot of side effects, and so they said, we'll see what we can do, but enjoy the remaining months of your life. So I was put in the palliative care cancer clinic, and I had a oncologist who was doing some clinical trials for different types of cancers that he was working on. So he put me in that trial and just said, try to keep you comfortable. And for whatever reason, that treatment actually started shrinking the tumor, and I remember my doctor being so excited, but like just cautious, because I said, oh, really? And he said, well, we'll see, it might change next time. So we would just go through that journey, and he bothered so many thoracic surgeons around here. It was like, I need you to see her. She's 19 years old. She's been through this once. She goes to U of T. Like, I need you to see her. And no one really would. And then once that treatment started working, one of the surgeons at Princess Margaret, he said, I'll see her. And so my oncologist was actually bothering his secretary. So that's the only reason he said he'll see me. And so we went to that, and he saw the story and he saw the results, and he said, if this keeps working, I'm going to see what I can do. And I was very lucky. I was 19. If I was 10, 20 years older, if I'd smoked even one cigarette, something like that, he had told me that we would not do the surgery for you. You would die on the table. And so thankfully that clinical trial drug kept working. I was able to have that surgery. So they removed most of the left part of my lungs, 3 ribs, and reconstructed all this stuff, and then sent me off into the world again to say, try to have your life now. And so here I was, a survivor again, but dealing with so many side effects, dealing with what to do with my life now. And being young, so many cases of cancer, especially we hear about, are diagnosed later. So you've been through so many life stages already before you get cancer. And so I was 15. So every experience that I asked you to start and think of for 15 to now, all of those experiences for me are layered with going to so many appointments for nerve block treatments every 2 weeks, to go to a nerve block appointment near my house, just so I can work. And I need to work so I can have benefits for my prescriptions, and acupuncture, massage therapy, all the types of things that are involved, the prescriptions and non-prescriptions. And it takes, a big toll on life. And I visited Dr. Flamer and his colleagues' cancer pain clinics, and we've tried so many things. And so something you might not think about is when I'm trying to try new medications, it can really affect your mood and your fatigue and sleep, and which would affect your work and how they think of you. So I have to schedule vacation days to try a new medication to make sure that it's not going to affect my performance at work. And so things like that, where maybe people can live more freely, and you think, oh, she survived, she's good. But right now, as I'm standing, my feet have arthritis and are burning. I have a lot of pain all over. And it's sort of, your brain starts to just normalize and internalize it. So you're not expressing it, but the amount of effort and fatigue and kind of mental focus that's needed to continue through life, and to make sure that you can go forward is a really high toll. And I know that I'm very lucky, but I have so many other friends, one, who've not survived, and I've been to all their funerals at such a young age, but also that haven't been able to deal with their pain or find sources in pain clinics. So many pain clinics have wrote me off. And I said, okay, I don't know what I'm supposed to do, but you have to keep persisting. And as new therapies come up, we're given access to them, and that can change my life. I wasn't able to work for a year because of my pain in my arm from chemo, late effects. And so once I started having these pain injections, I was finally able to work again. And I'm at a company that will allow me to work a few days from home, because my mom would know that I'm standing up here like this, but some days my pain is flaring up so much, I'm just in a fetal position and in my bed, and my mom has to help me with so much, and it just comes out of nowhere. And so being a survivor and being able to cope through those challenges but maintain a quality of life is really difficult. And throughout the summer at my pain clinics, a lot of other patients were just talking about the nerve block injections. So I get 16 to 20 every 2 weeks, and we were talking about how the changes might come along, that you can only get 16 in a year, and then the rest you'd have to pay out of pocket, or I don't know. And so for me, that's not just no pain, that's I can't go to work, I won't have benefits, what do I do with my life? I go on disability, but that, is that all that's left for my life at, being such a young survivor? And so these are the things that are constantly on our minds, constantly worrying about, figuring out what to do, managing our health, and the side effects is another full-time job. So to be I have this appointment this day, I have to start work later, log in later, log out later, have this meeting, go to this doctor is running late, so I'm gonna miss this work meeting. And so many people like me can't maintain a job. Like so many young people can't maintain a job, can't go to university, can't do these things because of these side effects. And so sometimes a small management of these things is such a huge life-saving thing for people. It's not just small, it changes our life completely. Like I can have a career, I get my own place, I can do all these things, and I'm very lucky. But most people don't have my experience. So that's why I'm standing here, because they are not able to come up here. They're in bed and they're like, please go on and talk for us. So that's why I'm here. And I didn't go through my slides really, but I just want to share more naturally my story. So thank you for being here to hear about it and to advocate for people like me and John, really. Thank you.